Hi everyone, I'm Lisa from LS Enhanced Advanced Aesthetics. Just making another little video now, following on from my previous one, giving you information about the hyaluron pen or needle-free filler treatment. Just wanted to keep the videos short, so I thought I'd do them in small sections. This one I thought would be about pre and post treatment advice, things that will make your treatment go better for you. One thing I will add to my previous video is I did say that it is suitable for any age, which it is, but you do unfortunately have to be over 18 to have the treatment. There's a few other things, like you shouldn't be pregnant or breastfeeding, you shouldn't take any medications that thin the blood, and it is not for people with heart or circulatory conditions or diabetes. You can be treated if you're diabetic and it's under control with medication though. Any other health concerns we would discuss and probably need a letter from your doctor perhaps. As far as pre-treatment advice goes, the number one golden rule is drink water, water and more water. And that's brilliant advice for your skin and your health generally, obviously, so maybe use it as an excuse to get into good habits with that. But the reason we need to drink water a minimum of 48 hours before the treatment is that the hyaluronic acid in the filler attracts water. So that will help to plump up your lips. If you don't drink enough water and your body is dehydrated, the hyaluronic acid will want to go off to other areas of the body where it's needed more, and we want it to stay put where we decide we want it. The other thing you need to know is that you shouldn't take any blood thinning medication at least 48 hours before the treatment, obviously to prevent you from bleeding excessively during the treatment. Most people get just pinprick bleeding, if that. So that would be things like aspirin and ibuprofen. They need to be avoided. Also need to avoid caffeine and alcohol, because they are very dehydrating and can cause you to bleed more. So again, about 48 hours before the treatment. Try not to have any treatments in the area that we will be treating, like waxing, electrolysis, glycolic acid, or use harsher products like retinol, chemical peels, that sort of thing, for 72 hours really. If you are somebody who suffers from cold sores, you will need to make sure that you have got some oral medication for that from the doctors or the chemists, and begin taking it probably 72 hours, at least 48 hours before the treatment, and continue on afterwards. You can also, if you're prone to bleeding, bruising, if you know you're somebody who bruises quite easily, you can take arnica tablets, which you can get from homeopathic health food shops or from the chemist, and you can start taking those about 48 hours before the treatment, just to help minimise the bruising. Now, post-treatment, the things that are common are swelling, bruising and tenderness in the area. That's it. You will swell up, and that will subside depending on your healing, probably within 24 hours, definitely between 48 and 72 hours. Another thing that is not so common but is considered a normal reaction is itching in the area. If you get this, you can take an antihistamine until the itching subsides. You can take arnica tablets for the bruising. Also, you will get a little aftercare bag. I should have had one here to show you, but I haven't. Within that, there will be the LS Enhanced branded lip balm, which also contains arnica, and you can put that on as and when needed with a clean cotton bud, just to help minimise any bruising. You get lumps sometimes in the area. we do the treatment, and then I will massage to help minimize this. But if you do find you've got the odd lump, you need to leave it alone for 72 hours, but then after 72 hours you can massage gently with a clean finger, or you can apply pressure for up to 10 minutes at a time, and that will help to disperse. Continue taking cold sore medication after the treatment if you suffer from cold sores anyway, and this will help to prevent or minimize an outbreak. Any treatment that you have done on your lips, if you have ever suffered a cold sore at all, even if you possibly don't remember, could have been quite some time ago, it will be prone to bringing on another outbreak. That includes things like permanent makeup, lip blush in the area, anything that breaks the skin, basically. Again, after drinking plenty of water and avoiding alcohol and caffeine for 48 hours, avoiding other treatments in the area afterwards, and avoiding extremes of temperature, so not too hot, not too cold. Immediately afterwards, avoid very hot drinks, perhaps drink them with a straw if you can. Then you need to just make sure that you don't do anything that will cause a large rise in temperature or dehydrate you. So you're needing to avoid things like exercise for 24 hours and things like sauna, steam room, that sort of thing for a good 2 weeks. That's about it. I hope that hasn't spoilt your fun. Feel free to go back to drinking coffee and alcohol after 48 hours, and just make sure you have a pint of water afterwards. Everything in moderation. That's about it, I think. If you would like any more information on any of my treatments, please go to the website ls-enhance.co.uk. You can also follow me on Facebook, Instagram and TikTok, where I will post details of special offers and treatments, and also look out for a couple of brand new skincare and anti-aging treatments that are absolutely brilliant that are coming up very soon.